Hi, we are from Group 4 Choose Personality as our topic. So we will present our case study, The Three Phases of Eve, 1957. First of all, personality encompasses distinct patterns of thinking, feeling, and behavior that define an individual's style and influence their interactions. Multiple personality disorder, now known as DID, is a neurotic condition where different phases of personality exist separately within one individual. Each personality has its own traits, memories, and relationships coexisting in one body. Objective of our case study is to explore the diagnosis and treatment of MAD through the case of Eve White, who suffers from migraines and blackouts. Under Dr. Tim Ben's scale, Eve reveals a distinct personality, which is Eve White, a quiet and shy human facing emotional struggles. Eve Black, a spirit party girl, and Jane, a balanced human, reflecting her repressed desires stemming from past trauma. In a synopsis, Dr. Tim Ben meets Jane's Eve that calmer and more matured personality, which leads to the discovery of Eve's traumatic past. At the age of 6, Eve's personality split after her mother forced her to kiss her grandmother's dead body, serving as a defense mechanism. Eventually, James remembers all the events involved Eve White and Eve Black. Realizing that the two personalities no longer exist, Jane brings them together, become whole again. So the film highlights how experience shapes our identity and choice, emphasizing trauma, recovery, and the strength of the human spirit in overcoming psychological challenge.
I am going to explain journal review. This is a case of multiple personality by Tickpen and Cleckie on 1954. This journal explored the case of a 25-year-old woman referred to as Eve, who exhibit dissociative identity disorder, also known as DID. Eve displayed two distinct personalities, Eve White, a reserved woman, and Eve Black, a more carefree and assertive individual. Over 40 months of therapy, the researchers conducted interviews, hypnosis, and tests to understand their personalities and their interaction. Eve White was unaware of Eve Black's existence, while Eve Black was self-sufficient and rejected Eve White's life, including her family. The therapist discovered that hypnosis could initially facilitate the switch between the personalities, but over time, Eve Black could take over without hypnosis. Both personalities had slightly different IQs, with Eve White scoring higher. After 8 months of therapy, Eve White showed signs of improvement, but her condition worsened, leading to the emergence of a third personality, Jane, who was more responsible and empathetic. Jane eventually gained more control over the personalities and helped Eve White's family's responsibilities. In 1975, Eve, whose real name was Chris Sizemore, revealed she had developed 22 personalities, which were a result of a childhood trauma. The case was groundbreaking due to its extensive data collection, including psychometric tests and EEG readings, but it was limited to a single case, and the reliability of Eve's memories was questioned. The case contributes significantly to the understanding of DID and the role of trauma in its development, although some aspects of the diagnosis and treatment have been re-evaluated since then.
In the studies conducted by Prieto and Lia Aulia were published in the Journal of English Language and Literature in 2019, the author explored the complex psychological themes presented in the film The Three Faces of Eve. The primary objectives are to explain the cause of Eve dissociative identity disorder (DID), compare her three distinct identity, which is Eve White, Eve Black, and Jane, and discuss psychological effect of DID on her mental health. Dissociative identity disorder, defined as the presence of two or more distinct personality state within a single individual. Each identity has unique behavior, memories, and emotional response. The film illustrates how trauma serves as a catalyst for Eve's dissociative symptoms, allowing her to escape from unbearable emotional pain. The author emphasized the trauma can lead to dissociative as a coping mechanism, particularly in individuals who have experienced multiple traumatic events during childhood. To analyze if conditions, Prieto and Aulia employ various psychological frameworks, notably trauma theory. The story highlights how children exposed to multiple traumas are particularly vulnerable to developing dissociative symptoms. The author also referenced Freud's psychoanalytic theories regarding self-defense mechanism and the role of unconscious process in shaping identity. The studies outline different types of traumatic events that can contribute to the development of DID. These include intentional human actions such as abuse and violence, unintentional human events like accidents and natural disaster. The author argued that these experiences can lead to the associative as a protective response, enabling individuals to detach from painful memory and emotions. In each case, her identities represent different coping strategies for her to unresolved trauma. The article further explored the psychological ramifications of the ID on Eve's mental health. Common symptoms include anxiety and depression, which often accompany dissociative disorders. The author differentiates between fear, a response to a specific object, and anxiety, which is a more vague and anticipatory. There are note that chronic anxiety can lead to debilitating condition if left unaddressed, while mood swings are prevalent due to fluctua- fluctuation fluctuating dominance of different identities. In conclusion, Prieto and Auli's analysis provide valuable insight into the representations of the ID in the three phases of Eve by examining the interplay between trauma and identity formation. They underscore the importance of understanding psychological disorder through the nuanced lens. Their work not only shed light on Eve's character, but also contribute a broader discussion about mental health and the complexities of human psychology. The film, the film served as point, poignant reminder of how unresolved trauma can manifest in profound way, shaping an individual's identity and experience of reality.
Hey doctor, my name is Li Yijie, battery number 298340, and now I'm going to talk about the case conceptualization of the case study. The case study by Tickman and Clegg highlights the biological foundation of dissociative identity disorder known as DID, emphasizing the connection between the nervous system and psychological phenomena. The central nervous system, CNS, comprising the brain and spinal cord, and the peripheral nervous system, including the somatic and autonomic system, regulate behavior and psychological occurrence. EGG tests in the study demonstrate that distinct personalities in DID are linked to the nervous system activity. Next, key brain regions like cerebral cortex are responsible for movement, planning, and sensory processing, and the limbic system, which governs emotions and memory such as amygdala and hippocampus, plays critical role in the DID. Childhood trauma often associated with DID can cause amygdala overactivity and hippocampal dysfunction. contributing to emotional dysregulation and fragment identities. That neurotransmitters such as neuroperipheral and dopamine are also critical, as stress can alter their levels, influencing emotions and behavior. This chemical imbalance, along with trauma-induced neural changes, underpin the symptoms of DID. Positive behavioral intervention such as mindfulness and altruism have been shown to reduce amygdala overreactivity, improving emotional regulation and managing symptoms effectively. This case underscores that how the interplay between the nervous system, brain region, and neurotransmitter shapes behavior and psychological disorder like DID, offering an insight into potential treatment strategies.
Now, this part is talking about the theory explanation about our case study. Our case study include two psychology theory, which is the first is psychoanalytic theory and the second one is the cognitive theory. The first theory, which is the analytic theory, links DID to childhood trauma. If personality like if black, if white, and Gen develop as defense mechanism to cope with events like abuse and witnessing a beheading, this identity compartmentalizes trauma, shielding the ego. Psychoanalysis aims to uncover repressed memory and integrate the fragmented identity. Second is about the cognitive theory. Cognitive theory explains the DID as the interrupted memory process caused by the trauma. Each personality have distinct memories and behavior reflecting the fragmented self-representation. Therapy focuses on reprocessing trauma and bridging the dissociative gaps to identify identity. Now, this part is talking about the suggestion to overcome this problem. If suffer from dissociative identity disorder, which is characterized by two or more distinct identities that take control of her behavior, the primary treatment for DID is the psychotherapy, particularly is the cognitive behavior therapy, which is standing to CBT, which help patients identify the trigger, manage to control their emotion, and replace the negative thought with the constructive one. For example, the if may replace I can handle it becomes I have managed this before and I can do it again. CBT also teaching coping the strategy like deep breathing and grounding exercise to reduce the anxiety and improve the control over the identity transition. Another essential approach is about the identity integration, which involves the building safety and trust with the therapist, understand the purpose of each identity, processing the purpose, the trauma, and eventually merging the others into a unified sense of herself. This process emphasizes harmony among the identity, allowing it to achieve the emotional stability and a cohesive identity. Through the challenging this method foster recovery, improve the emotional well-being, and enhance daily function.